Hi, everyone. Thanks so much for joining us tonight. I really appreciate you taking time out of your evening for our webinar. Um, Before we get started, I just want to do a quick AV check. If you can hear us and see us, please put a 1 into the chat box. Awesome. Thanks, Jordan. Thank you, Melody, Pat. Awesome. Thanks, guys. Okay, cool. So we're up and running, which is great. A very warm welcome to Please Don't Think That's Normal. I'm really excited to be here with you guys tonight. The goal of the presentation is to really give you an idea of how you can start solving your digestive problems today. At the Nutrition Clinic for Digestive Health, we are really big believers in that most people suffering from digestive problems do not have to live with them forever. And we like to help people figure out what's underlying their digestive problems so that we can help you solve them. My name is Jenny Askew. I'm the owner of the Nutrition Clinic for Digestive Health. I'm going to talk more about myself in a little bit so you can get to know me. I am a dietitian with a master's in nutrition, and I have 3 years of training in integrative and functional medicine with a focus on GI health. And who here, raise your hand or say, yes, that's me, whatever you want to in the chat box, but who here has been told that their digestive problems are normal and just something that they have to live with, or even worse, that your digestive problems are all in your head? And if that's you, yeah, yes, I'm seeing you guys in the chat box, right? So we are here for you tonight. We want to help you guys. Perfect. Y'all are in the right place. Figure out why you have digestive problems so that you can get your life back. We don't want your life to be driven by digestive issues. So I'm going to do everything in my power tonight to make this workshop a life-changing experience for you. And we also want this to be interactive. So we're going to be asking questions, interacting with you guys in the chat. And if you have questions, we want to make sure we get to them tonight. So pop them in the chat box. And at the end of the presentation, we're going to go through and answer the questions that you've got. And a big congratulations to you guys for being here tonight. This is a really big step in solving your digestive problems. So you are taking a proactive step in your health. And I hope that this is really the night that starts moving the needle forward for you on your journey to improving your digestive health. So we're going to be revealing things that you can do to start solving your digestive problems right away tonight. And these are things that will help anyone suffering from digestive issues. So I'm excited that we get to share those with you. And even if you think you've tried everything, I promise you that there will be something that you get out of this presentation that's going to help you take a step forward on your health journey. And I'm sure you guys have all experienced or can agree that healing journeys are not linear, right? There's ups and downs and bumps in the road. And healing journeys can look different for everyone. So on average, it takes about 6 months to heal the gut. We see people heal faster than that, and we see people take longer to heal their guts. It really depends on your starting point and where you're coming from with that. And then when it comes to healing the gut, we really want to focus on progress, not perfection. So for some of you, pooping 6 times a day versus 12 would be a big improvement. And for some of you, pooping daily versus pooping every 3 days would be an improvement. And we're going to talk all about normal bowel movements and what those are, and get into all kind of the details around that. But we don't go from severe chronic digestive issues to perfect digestion overnight. It does take time. And there's going to be things that really improve, and then there's going to be setbacks on your journey to healing the gut. So just kind of laying that out in terms of what to expect. And so the fact that you were here tells me that you want to feel better and you're not giving up until you get some answers, which is awesome. I'm willing to bet that you've been to doctor after doctor with no real answers as to why you don't feel well. Our typical client is also high functioning with chronic, but not necessarily debilitating health issues, and your lab work might even come back normal. Um, and I bet that if you're here, you've also tried solving your digestive problems on your own with maybe elimination diets, low FODMAP diet, probiotics, more fiber, less fiber, several supplements, and you're just realizing that you would really benefit from some guidance with all of this. And so people that this is not for, I wouldn't recommend this presentation or working with us if you are not willing to make significant dietary changes. So sometimes food is what gets people stuck, and we're here to help you move through that. All foods in moderation do not work for everyone. And we also believe in removing things from your diet, but only temporarily, so we can kind of assess, whether or not they're causing an issue a lot of times. And if you don't have 1 to 2 hours a week to dedicate to self-care, we're probably not a great fit for you. In terms of self-care, we're talking about things like meal prep, being prepared to meet with us as a dietitian one-on-one once a month, and working on necessary lifestyle changes. And then if you're not open to advanced functional testing and supplementation when needed, we're not a good fit. A lot of times we use testing and supplements to get to the root cause of what's going on with you in terms of your health. So that will, testing gives us answers that help you move forward. And supplement recommendations are always individualized, and they are typically part of our protocols. So tonight we're going to show you what's possible if you remove the barriers that are preventing you from finally solving your digestive issues. And we're also going to share really simple things you can do right away to start improving your digestive health. So even if you think you've tried everything, the things that we're sharing tonight are really impactful, and they're often overlooked, which is what I love about them. They're easy, they're simple, they don't cost a ton of money. And if nothing else, I really want you guys to think about how solving digestive problems can add literally years onto your life, right? Because digestive issues cause inflammation, and inflammation underlies all of the things we don't want, right? Cancer, diabetes, heart disease. If we can solve your digestive issues and get rid of the inflammation that they're causing, there is a huge, huge benefit to that. And if you stay until the end, you're going to get some really great insight as to why you haven't been able to fully resolve your digestive issues. You're going to learn how to start uncovering the root causes of your digestive problems so you can fix them. And we have over $1,000 in bonuses and savings exclusively for webinar attendees if you can stay until the end tonight. And then we're also doing the Q&A at the end. So just a reminder, I know we still have people joining. If you have questions, pop them into the chat, and we're going to go over all of the questions and get them answered for you guys at the end of the webinar. So this is me. Again, I'm Jenny Askew for those of you just joining. I'm a registered dietitian. I have a Master of Science in Nutrition with 3 years of training in integrative and functional nutrition. My undergrad's in kinesiology, which is the study of movement. I have a background in personal training, and I'm a cancer survivor, a wife, and a mom of 2 kids, and I've been in private practice for over 12 years. And I wouldn't be able to do anything that I do without my team. So Rachel and Erica are dietitians, and Jordan is our client care coordinator who's in the chat tonight helping out. She's a really awesome VA that keeps everything running for us in the background. And I'm gonna let Erica and Rachel introduce themselves in a minute. But one of the really cool things that I love the way that we all work together is that we meet once a week, and we go over any tough cases. So anyone that is working with one of us is essentially getting all of our eyes on their case if they're struggling. And we bounce ideas off of each other, give each other feedback, and really help make sure that all of our clients are really doing well. That our goal is working with you is to truly help you, and we really do care about your success. So that's super, super important to us, is that you're working with us, that you're getting really good results and feeling better. The other thing I love about our team is that everyone on staff is a registered dietitian, and we have all had really great training in integrative and functional nutrition on top of that. If you're in the Atlanta area, like we are, well, I am actually. Rachel's in North Carolina and Erica's in Wisconsin because we are virtual. We can work with people anywhere and we can work from anywhere, which is really cool. But because I've been in Atlanta for so long, we have a lot of physicians, therapists, and dentists that we work with in this area that we can give really good referrals to should you need care outside of what our scope of practice is. So Rachel, I'm going to let you go ahead and introduce yourself.
Great. Awesome. Thanks, Jenny. So like Jenny said, my name's Rachel. I've been a dietitian since 2017. Fun fact is Jenny and I actually went through the same master's program, and we had like the similar job before we were working at the practice, which is such a fun fact. I have my master's in nutrition, and then I also have additional training in integrative approaches. I love SIBO. It's one of my favorite things to do. In the practice, just working through all of that, helping patients identify root causes and finally get the help that they need is one of my favorite things to do one-on-one with clients. More personal information about me. I'm a part-time yoga teacher. I love teaching heated vinyasa and taking class as well. I'm a wife and a twin mom, so I have two 14-month-old little boys. And then I also have a special interest in women's health and fertility. So anytime those cases come in, I always like seeing them and helping people along the way for that. And my favorite parts about being a dietitian really is bringing two things that I love to do together, which is learning, really getting into the weeds of the whys, and then also bringing in food and cooking and spending time in the kitchen and creating beautiful, healthy meals.
Awesome. Okay, so I'm Erica. I'm also a dietitian. I have over 15 years of experience, and really the past about 10 years, I've been specializing in this functional health and GI conditions like SIBO and IBS. I also really have a special place for autoimmune conditions. I feel like all of our approaches actually really go beyond traditional nutrition. I like to incorporate health coaching techniques. I have a health coaching background too. And I think it helps connect clients and guide them towards like a better relationship with their bodies. A lot of us are really resistive to all these symptoms, all the things that are going on in our gut. But when we can stop fighting against the body and really start working with it instead, that's when the body can start to heal. I also love playing that health detective, diving into each case and looking at the clues, putting those pieces together of the puzzle to help someone understand what's going on with their health. And, you know, we use our clinical background. We're all the dietitians, but we also use these functional medicine principles. So I think that really helps us have a better holistic picture of how diet and lifestyle, gut health, medications, even all of those things work together. On a personal note, I have 3 teenage kids. One just went off to college. They all keep me extremely busy. We love traveling as a family. I also love making new recipes. And in my free time, I am really learning more in this functional space. There's so much to learn. All right, I'm going to jump right in with one of my past patients. And I'm wondering how many of you see yourself in this patient for some reason. So this is Mary. She is a wonderful 60-year-old woman. Despite all of these daunting health challenges, as you can see, celiac, hypertension, hypothyroid, IBS diagnosis, GERD and on PPIs, prediabetes, history of melanoma, and really significant sinus issues to the point where she can't really breathe, especially at night. She came to us and she was just refusing to let her conditions define her life. And I hope you see there is no perfect time to get started. During our 3 months together, she was in a car accident. She had a fall and had a concussion where an emergency vehicle had to take her away. Family members were ill. She had switched jobs, and still all through this, because of the work we did together, she persisted in a way and we made it reasonable for her all the way along to go through the healing. She came feeling really trapped by her symptoms. And in her own words, she said she's tired of always being afraid of not knowing when she had access to the next bathroom. She liked to travel too, and she was really afraid to do any of that because she didn't know the bathrooms where they were. And she was tired of feeling terrible, having to sit up to sleep due to her acid issues. And she was just really frustrated as well. She wanted to lose some weight. So we worked together for 3 months. We did the specialty testing. We met bi-weekly. And throughout our sessions, she started changing some dietary things, lifestyle modifications. She was on supplements, and just coaching her through all of the struggles she was going through. She really experienced a traumatic turnaround in just that 3 months. She felt, and from her words, she regained control of her digestive issues. She improved her quality sleep. She finally broke through her weight loss plateau. Towards the end of the program is when, the body started allowing for that weight loss. So I hope you can see her journey is really a testament to like a huge transformation. Addressing those root causes is the key. It's the precision specialty testing when the body can heal when it has the right inputs. So it really restored her confidence and, most importantly, her quality of life, even though she had all of this going on. And not the prettiest picture here, but what I was trying to get across for you. So you can see the first one is her initial digestive symptoms, and 4 being the highest score you can rate, and 0 being the least. And you can see just in 3 months later, she had a 70% improvement in her overall digestive issues. We, every session, assess what's going on, not just digestively, but in energy, and a bunch of other things. And so we're really paying attention to everything that's shifting and changing over time. So I hope you can see from this that consistency, determination, and really just being honest with yourself and what you can do, and taking the most of the time together is very impactful.
All right, well, I'm going to jump in and talk about Casey. So she was one of my patients, and looking at her pictures just taking me back to how we got started together. I remember her coming to see us just because her symptoms were really impacting her quality of life, really similar to Erica's patient, but in a different way. She was younger. It was things like going out on dates with her boyfriend, going out with her friends, traveling, kind of enjoying a lot of that time of her life that she felt like she was missing out on because of her GI issues. And one of the things about her case that really stands out to me is that she really put her trust in us. And it ended up being a really enjoyable case for me because we got to know her doctor very closely, and he ended up being one of our best referrals to today. So it just kind of highlights how we also work in that team approach. We never want to work against your doctor. We always want to work with your healthcare team to get you the treatment that you deserve. In her situation, we had to do some adjusting of medications. But I think the main thing that stands out to me about her too is that she really went all in on the testing. We did some investigating, we did some detective work, and she was super compliant with her protocol and had big results paid off. And so at the end, when you're working with a client, seeing them, be able to tell you, oh, I can do this, and that with my friends, I can enjoy the holidays. I can travel and go enjoy so many other things in my life because this is not taking up so much space in my life, is really rewarding. And what I want you to take away is that it can also be you.
Love that. You guys, thanks so much for sharing those cases. And I think one thing that's really important to point out with both of those clients is, how much we really care about them, and that we're just holding their hand every step of the way until they are better and really seeing a lot of improvement. And that's one of the best parts of our job, I think, is just working alongside people, getting to know them, getting to help them, making sure that they have everything that they need in order to heal their digestive issues. So this slide is just how I personally feel sometimes. Has anyone else ever looked back on their life and just felt like it was such a wild ride? You're kind of like, how did I get here and what just happened and why? And like it's just like you're kind of like wow and just totally blown away by your journey and your experience. I'll get into my personal story in just a minute. But another thing too is that, as dietitians, we have a lot of respect for conventional medicine. And I think that one of the things that sets us apart is that why we have a lot of respect for it, or while we have a lot of respect for it, we also understand that it can be really incompetent. I do think a lot of us have been victims of inadequate care in the conventional healthcare system at some point. And we're not here to slam conventional medicine at all. We work alongside a lot of conventional doctors. We work with them together and have really strong relationships with them. Um, Conventional medicine can save lives, and it's super important to see a conventional doctor. But when those things aren't working, when the conventional approaches aren't effective, that's where we come in and help you dig a little deeper and really get to the root causes of what's going on with your health. So, unfortunately, I know firsthand what it's like to struggle with answers to health problems. My now husband's story started in 2006, and I remember leaving his college apartment one night to go home, and he was having chest pain. And I just thought it was really strange that he was in his early 20s having chest pain. And I went home and I was like, well, this doesn't feel right. Maybe I shouldn't have left someone alone having chest pain, but he's so young. Surely it can't be anything serious. It was just kind of weird. Like I remember that night, I remember driving home and how I felt. Um, and then after college, he was in graduate school, and we realized that the chest pain that he was continuing to experience, whoops, I didn't mean to go there yet, was acid reflux. And fast forward to 2008, we had just moved to Atlanta, and his acid reflux was getting worse. And it was at the point where he could no longer sit down to eat. He had to be on medication. Just the mechanics of sitting down to eat for him would bring up more acid reflux. So he literally had to eat all of his meals standing up. And we had just moved to Atlanta and we were in our 20s, and we want to like explore the new city and make new friends and go to all these cool restaurants that we have access to. And we really like were both debilitated by his condition. And we couldn't really get any answers from any doctors other than take this pill. Oh, that one didn't work. Try this one. It's actually the same as that one, but it's a little bit different, so it might work. And we were just like what? Like what is going on? Like this is so weird. Like why don't the doctors have any answers for us? We've never experienced anything like this. Um, and one afternoon, it's a very long story, but we ended up in the emergency room, and I was showing the ER doctor pictures of my husband's esophagus because I was carrying around pictures from his endoscopy in my purse, because at this point I was just desperate for answers and I was reaching out to anyone and everyone who could possibly help us. So I was just ultra prepared. I pulled out the photos and I was like, look, can you please look at this and tell us why he literally has like holes in his esophagus. Like he had ulcers and they were very large and very concerning. And the ER doctor was like, well, you know what? That's from acid reflux. Acid reflux is nothing to worry about. And he said, my esophagus looks like Swiss cheese and I'm completely fine, meaning that the ER doctor had multiple holes in his esophagus as well from acid reflux. And I was like, okay, that was a turning point for me. This is, just not acceptable. It's not normal. We're not going to live with my 20-something-year-old boyfriend having holes in his esophagus. Like, that's not okay. It's not normal. Like, our body shouldn't look like that. Like, I just knew something was wrong and we had to do something a little bit differently. And here's what really gets me about Blake's case is that this is him when he's at his sickest, and he doesn't look sick. Like he is a very high functioning individual, even though he was really chronically ill. He could do anything he wanted, but he never felt well. He never had extra energy for things. really, like it was very debilitating for both of us. And while all this was going on, I had a friend in graduate school because fatefully I was studying nutrition and getting my master's during this fiasco. And my friend had gotten rid of her psoriasis with a special diet. And she had had blood work done, and the blood work told her what foods were causing inflammation. And she took the foods out, and it got rid of her psoriasis. So I was like, well, okay, if this helped my friend's psoriasis by doing this diet, like, why don't we give it a try for the acid reflux and see if we can get it to go away? Um, so we did. I found a dietitian who could help us with food sensitivity testing, which this is now what we know and love and use as LEAP MRT. And we did that. We had him tested for celiac disease, and we looked at nutrient deficiencies as well, just to see like where we could support his body and really just help get some answers as to what was going on. So we finally started seeing some improvement with him, major improvement in just a couple weeks, which was awesome. Um, and another really interesting thing about working with a dietitian that we worked with was she was asking questions about his medical history that we had never thought about, and the doctors that we were seeing had never really asked about either. So it was really eye-opening to start to think about things from a different angle. And what we really realized is he was on an antibiotic in high school for acne called Accutane for 3 years, which is a very, very, I just can never get over this part of the story. But 3 years is such a long time to be on an antibiotic. So typically, like a 2 week course of antibiotics is going to take about 6 months for the gut to recover from. So this was a case where Blake, I mean, he took several years to really get back to normal, where he could eat pretty normally, minus gluten. With all of this testing going on, we realized he probably does have celiac disease as well. So he was constantly, before he knew better, eating gluten, and with the history of antibiotics, his gut was a mess. And so putting his pieces together a little bit, like we do for our clients, he was compromised from the antibiotic. And then on top of that, he had gluten tearing up his gut lining because he is a true celiac. And then he was coming out of college and graduate school. So those are stressful environments, and they're environments where we're not eating well or really nourishing our bodies, right? Let's be honest. Lots of pizza, lots of beer, not good for the gut. And then looking back now, it's really interesting. He suspects that he was always reactive to gluten, which makes sense for a true celiac, but also he has some pretty close family members who also have celiac disease or are very likely to have celiac disease. And so I was in graduate school studying nutrition, so you would think that I was like really on the up and up on all of the stuff he was going through, and I wasn't, because we weren't taught this in graduate school. I went through, after this case, in his case, and knowing what I know, and I went out to pursue additional training because I was realizing there's so much that not only did I not know, but I didn't even know I didn't know it. So it was really eye-opening. So fast forward with his case, and within a year, he was off all of his meds, and he can eat normally minus gluten because he most likely is a true celiac. A few years it really took to rebalance his microbiome and to be able to eat things with sugar without going into a tailspin of feeling bad. And then, like I said before, we found out other members of his family do have celiac disease. So what I got from his case, and what I truly believe, all of us are on the same page about this, but the body can heal itself, but you have to give it what it needs. So decreasing inflammation goes a really long way, because when you do this, the body can divert all of its resources to healing and repair. Balancing the microbiome is really helpful too, with digestive support if needed. So a lot of us don't even have what we need to properly digest food, which is really interesting. We're kind of like don't even have a chance from the beginning of the digestive process. And then repleting nutrient deficiencies, because healing requires energy and nutrients. And a lot of times with digestive issues, we're not absorbing the nutrients that we need. Nutrient deficiencies also increase the stress response, which increases nutrient needs and drives you further into depletion. So all of these pieces are really part of a bigger picture and even a cycle of what can be chaos if you're not correcting the imbalances. And you might be thinking at this point, like that's a great story for you, but I've literally tried everything. I would have said this too at some point because Blake and I had tried different diets. We had tried like the standard acid reflux diet, cut out the common trigger foods, and we got some improvement, but not very much. For him, definitely the food sensitivity testing was a game changer and got really quick results. If your doctor said your condition has nothing to do with your diet, it absolutely does. Anytime we have issues in the digestive tract, our diet's impacting that system every single day. So we do have to get diet right in order for that system to heal. Elimination diets can certainly be overwhelming. So if that's kind of a pushing point for you, you don't have to go there. If they haven't helped in the past, it might seem kind of pointless to try again. But I will say, like, a personalized elimination diet with our coaching and support can really be key to helping you move forward with digestive issues. So the people that we work with that are the most successful are coachable and willing to take action. So you've got to be able to do what we're asking you to do, obviously, to see the results. We want everyone focusing on progress. We don't need perfection, but we do need to be at least taking steps forward, making small changes, making progress over time, because it really does add up. And we don't want to let self-doubt get in the way or stop you from having what you want. So don't get in your own way by thinking that this might not be for you or that you can't fix your digestive problems, because we have a lot of success helping people fix digestive problems. So even if you think you've tried everything, I promise you guys at this point, we've worked with thousands of people and helped them successfully solve digestive issues. One of the really powerful ways we do that is with functional nutrition testing, because we can identify and correct the exact imbalances that you're experiencing that are driving the digestive issues. I think between the testing and being able to decrease inflammation with diet, they're just so powerful and total game changers. So whatever you've been through, whatever you've heard, whatever your experience has been, just be open to what we're recommending tonight, because I know what we do is really powerful, and I know, how many people that we've helped. So also, this is a fun exercise. Imagine a future without digestive issues, right? Where you can eat whatever you want without having to worry about your next bowel movement, because that's not normal. We want this for you guys. My goal in working with people, and Erica and Rachel would agree with them too, but it's for you to be able to go out and enjoy an evening out with friends, or enjoy a holiday or a vacation, and not have to worry about food and not have to worry about how you're going to feel on the trip, because you have a body that's healed and resilient and can handle lots of different foods without having a lot of digestive issues. We don't want you to be afraid of food. And imagine going to the bathroom on a regular schedule. So several of you might not know what that means. We're going to get into it in a minute. But normal bowel movements are 1 to 3 times a day. And bowel movements should be easy and leave you feeling completely emptied. You should feel better after you have a bowel movement. And imagine how much more time you would have in your day or even in your mental space if you weren't constantly worrying about struggling with digestive issues. Yeah, so just kind of imagine what that would look like for you in the future.
All right, I'm going to take over and talk to you guys a little bit more about putting the unique pieces of the puzzle together. And we always say that working with us is truly like putting a puzzle together. You kind of have to organize the pieces, try this, try that, till you get to the answer and until you get someone healing and feeling well. And what we tend to see is that there's some big pieces that are often being missed with our clients prior to coming to us, even after seeing well-meaning and educated practitioners, but a lot of times they might not be asking the right questions or connecting the dots. So we really get to know you on a holistic level by having you complete a functional nutrition assessment for us, doing a full intake form of everything that you have going on in your health history before we get started. So if you decide to work with us, of course, we talk about diet and exercise, but we'll also be talking about things that you might not even think are related to digestive health. So this could be, your medical history, trauma, head, neck injuries, medications, supplements, lab work, sleep, stress, lifestyle. All of the things are included in that assessment. Right? And if you're suffering from one of these conditions, I want you to know that you're in the right place. We do specialize in gut-related issues like the ones listed here, but we also deeply understand the whole body on a functional level. We don't limit ourselves to just the gut. That's why in the beginning, we kind of share a little bit about what we like working with, too, because it does, a lot of these things are connected, right? IBS can also be connected to endometriosis or issues with fertility. So the gut is a great place to start if you're suffering from systemic issues as well. All right, so let's talk about the Bristol stool chart. If you haven't seen this before, get comfortable with it. We're dietitians that work with digestive health, so we talk about poop all the time. And that's like a joke that I tell some of my friends and family. I'm like, yeah, I talk about poop all day with my clients. So it's something that you will talk to your dietitian about, and it's something that we want to help you guys work through. And so let's get on the same page about what a normal bowel movement is. So a lot of our clients have had digestive problems for so long that they don't even remember or know for sure what normal is. So nobody's leaving here tonight without understanding this. What is normal would be considered types 3 and 4, and the frequency being around 1 to 3 times per day. You want to make sure that you are going in that range because it supports healthy digestion and proper elimination of toxins of what the body needs to get rid of. Your bowel movements should feel complete and elimination should be easy and you should not have to strain. So if you're seeing types 5, 6, and 7, you're definitely leaning more towards diarrhea. Types 1 and 2 are going to lean into like a little bit more towards constipation. All right, so let's talk a little bit about what the conventional treatment for digestive problems might be. So if you're lucky, your doctor might give you general diet guidelines, maybe a really nice looking, or maybe not even nice looking low FODMAP handout and kind of send you on your own and tell you to figure it out. So this typical GI doctor's visit, it can be very helpful, and we do recommend our clients having a GI doctor on board because you can rule out more serious things like IBD and cancer. It's actually something that we do, I wouldn't say very frequently, but it has happened a couple of times where we have referred people to a GI doctor for blood in the stool or things like that, where we do want to make sure we're doing our due diligence for anything that might be scary. Solving digestive problems by treating the symptoms is something else that they might do. So your symptoms might feel better but aren't resolved. New symptoms may continue to pop up. Maybe they're giving you a medication, pill for an ill. I like to call this the whack-a-mole syndrome, where you have something going on and then they give you a pill for it, and then 5 things start popping back up, and then you have to take another medication for it. So, something to watch out for. That's why you do want to be careful with medication, and, make sure that you are making, best decisions for you. Next slide. So some ineffective solutions, some things you might hear, or maybe you have heard before, maybe this does apply to you already, that it's normal, or it's all in your head, or you're like making health issues up. You're fine, try this medication, you need more fiber, or you eat too much fiber, or you're just like, well, then how much fiber am I supposed to be eating to begin with? Or you should try a probiotic. Those are all things that you might hear where you're probably rolling your eyes being like, yeah, I've been told that and none of it has worked before. But then let's talk about the actual causes of digestive problems. So a lot of times, you can have an imbalance of good and bad bacteria in the gut. The key to a happy and healthy gut really is a robust microbiome, meaning you have a good variety and a high amount of helpful bacteria thriving in your gut. A diet full of nutrient-dense foods is really key to maintaining this environment. The bacteria really eating, having proper amounts of fiber is super important. An imbalance of good and bad bacteria is not about just a general probiotic. In fact, some of the ones that you might pick up at Whole Foods or a grocery store sometimes can make things worse depending on your situation. Or it can be a parasitic infection, which is hard to detect, which is why we picked the test that we picked with 3 separate samples to help you guys identify it. Lack of digestive support, enzymes, stomach acid, motility issues. Again, why did these occur? And a lot of this stuff is a lot more common than people realize. Food sensitivities. Why are you so sensitive to food? Why can you not eat things without having symptoms? Stress, poor diet. It's really hard to get away from the stress of today, the toxins that we're exposed to constantly. Our whole lifestyles are surrounded by screens, spending time inside, not enough time in nature. And all of these things can kind of create that perfect storm for symptoms to pop up. Right? So what we want you guys to take away is that we don't want you to become a statistic. 5 to 10% worldwide, but 10 to 15% of the US population has IBS. There was a study where they looked at 2,000 patients with IBS, and their diagnosis was made 6.6 years after their symptoms began. So on average, meaning some people will wait even longer than this. People were waiting 6.5 years to just get a diagnosis. And IBS is a tricky diagnosis because it doesn't give you a lot of information. It's a syndrome, but without any answers at all, which is a long time. So poor quality of life can definitely come into play. Many people with moderate to severe IBS having a poor quality of life, missing time away from their families, from work, from living the life that they've imagined of living. And then can also contribute to mood disorders. Of course, being so preoccupied around going to the bathroom, not being able to eat what you want is going to make you not feel great, mentally. But also having these issues can also make depression and anxiety worse. It's kind of a self-feeding cycle with all of this. So there are more studies with people with IBS. 2 out of 5 people have long periods without symptoms. So you do tend to see this ebb and flow of symptoms. Sometimes they're totally fine. Sometimes they start feeling sick again. But 10 years after their diagnosis, 3 out of 5 people still have lasting symptoms.
All right. So who is ready to get to the bottom of your digestive problems? Throw a 1 in the chat or raise your hand. I love the section Rachel went over, and just, does that sound like you? Have you been going through those things? A lot of people feel like they are alone because nobody talks to their friends about all their bathroom problems. So you'd be surprised how often this is happening for people, and know you are not alone, and know that we're not intimidated by whatever you bring to us. We love solving these things. Okay, I see a lot of ones. We are ready. Okay, so I'm going to talk about 3 powerful, actionable strategies that you can implement today, even that's going to boost your digestive health. And these are not quick fixes. We're really going to focus on foundational habits that will long-term help improve your gut function. So whether you have just occasional discomfort or more chronic issues, get ready to learn some game-changing tips to help take control. There are a couple things we need to talk about first. One of these is leaky gut. What are these common pitfalls? What is causing leaky gut? And Rachel referred to some of this, but I want to get a little more in depth. So leaky gut is where that intestinal lining becomes too permeable. So things are able to get in and out when the gut lining is really supposed to be that selective gatekeeper. So when things can get through that aren't supposed to, it really can cause immune issues and many other things. So there are common factors that contribute to this problem. Diet does play a really crucial role. So for people that have more of that leaky gut, gluten, dairy, excessive sugar, processed carbs, all of those things just exacerbate the problems. And we're not here to demonize foods. Our whole goal is for you to have the most variety in your diet as possible to not have symptoms. Sometimes in the short term, while we are healing, we do have to restrict some of these things to get faster progress. So I just want to put that out there. We are not the food police. Stress, another significant factor that often goes overlooked. We all think stress is normal and, we're functioning just fine. But I will tell you, if your brain senses that there is stress, it's telling your body that too. And that chronic stress really upsets that delicate balance in the gut. And it can affect motility, how food is moving through the body. Medications is another really big one. And things like antibiotics and NSAIDs, they're really necessary at times, but it really can upset that gut flora. So it's important to really use them appropriately and consider extra gut healing support when you do need those. And environmental toxins are also a concern, and we get them from so many sources. So food packaging, personal care products are loaded with it, cleaning supplies. And then we don't always think about this, but our water and air, we're breathing and drinking water all the time. If those have toxins in them, we're getting exposed constantly. And while we can't eliminate all exposure, being mindful about reducing it is going to be very helpful. And lastly, one of the biggest pitfalls is ignoring symptoms. It's common to hope that these things are going to resolve and go away on their own. And sometimes, like Rachel mentioned too, like it'll ebb and flow. But oftentimes what ends up happening is they get worse over time if they're not addressed. So I also want to cover the basics, and many patients come to us already doing all of these things, but we do always stress this all the way through. So first, focusing on whole foods, those high quality proteins, healthy fats, plenty of vegetables. We do understand when people are dealing with these digestive issues, sometimes we have to stick to just cooked veggies. Veggies can be definitely a hard one to handle. I would suggest try eating veggies first and cut out those processed foods altogether, something pretty simple. It's not just about food though. Stress management, getting quality sleep, regular movement, all of those things impact our gut, and our gut bacteria actually changes daily based on all of those different inputs that are happening. So you can make significant changes really quickly to the gut. Interestingly as well, eating less frequently can be beneficial. So forget that myth of needing those 6 small meals a day. What we need to do is actually give our digestive system time to rest. And I'm going to get more into that in another slide. Now, I know these habits do sound simple, but they're really not always easy to implement. All of these things, trying to make it all happen. So we understand that struggle. So, however, we keep emphasizing these basics because they are fundamental, some of those inputs that are needed for the body to heal. So if you are already nailing all these habits, that's awesome. If you're still not seeing results, don't worry. We definitely have more advanced things that we're going to start talking about now. So let's talk about those unsung heroes of digestion. And it's so sad because these players are rarely talked about. I'm going to have to talk about chewing, the migrating motor complex, and vagal nerve tone. These are what we call the behind the scenes player, but they're really crucial for optimal gut health. So first off, don't underestimate the power of chewing. It's really that first step to digestion. So the more we can chew and break down our foods, it triggers enzymes and saliva production. And when we chew properly, it helps increase nutrient absorption. It aids in portion control, obviously, because you're eating slower and you feel full sooner, and it reduces the risk of bacterial overgrowth, actually. So I'm curious if you've ever counted how many times you chew before. Ideally, you want to aim for about 32 chews per bite. I know some things that are softer, you don't need quite that many. Some you might actually need a little more, but I challenge you. I don't know if you're eating now or if you're going to eat after this, but try taking a bite of food and chewing 32 times and see how long it takes to eat your food. Now I'm going to talk about the MMC, the migrating motor complex. This is your gut's cleaning crew. It's active when you're not eating. That's why I talked about not eating those 6 small meals. What happens when you're not eating? It's sending electrical impulses to repair and clean up that gut lining. So to support it, we really need to space out meals 3 to 5 hours apart and aim for 12 hours at least overnight for fasting. There are also techniques that we'll talk about individually with people if we notice an underactive MMC. Ginger, for example, can be a natural stimulant if things are moving too slowly. I also want to bring up the vagus nerve. This is, it orchestrates muscle contractions, and it helps move food along through smoothly. But there are so many things that affect the vagus nerve: stress, age, certain diseases, trauma, all of those things can weaken it. But the good news is you can strengthen it. It is like a muscle. So through different techniques, breathing exercises, for example, cold exposure, even things like humming or singing before eating can also set you up for success. So I know these are often overlooked, but super important digestive things to look at. And we do look at these closely with all of our patients. So make sure you are focusing on these. And I know chewing is one you could just start with today. Okay, so let's talk about supercharging our gut health with the right foods. The right foods really matter. I talked about how our gut bacteria changes daily. So just starting with some of these good things can really help. At the top of our list is bone broth. The reason being, it's a powerhouse. It has a lot of amino acids in it. There's collagen, gelatin, and minerals that a lot of American diets are lacking. It's really fantastic for healing a leaky gut. It helps improve bacterial balance, and it keeps that digestive tract robust. Some other things to consider would be fermented foods like sauerkraut or kefir, because they're packed with those probiotics, the good bacteria. Things like leafy greens and berries have a lot of antioxidants and fiber that feeds the gut lining. When we get so restrictive on our diet, when we can't tolerate a lot of things, we're missing out on all of those things that are feeding the good bacteria. So it's something we really work towards, is being able for you to tolerate more foods and have that diversity. You can also spice things up with turmeric or ginger because they're very anti-inflammatory. Some people, though, need more soothing sort of properties. Everything's kind of inflamed or in pain. So things like aloe vera are really good for that. We try to incorporate more foods that have glutamine. So glutamine is found in things like meat and fish and eggs. And that amino acid is really important to fuel those gut lining cells. Omega-3s are really another food that are really good. So salmon, for example. And then I always think about prebiotic foods. So there's probiotics. Those are typically those supplements that you take. The prebiotics is what feeds probiotics. So those are things, foods like garlic, bananas. And like I said, it feeds the good bacteria. So by incorporating, trying to get more of these in, and we don't have to do all these at once, but trying to get more of these in will really help. It's not just for, the cells, but it's also for healing, and it's rebalancing the gut bacteria. So there is one brand we really like, and my husband and I just did a day of this actually yesterday, where we use these bone broths instead of meals. So we often recommend that because it takes so little for your body to digest the bone broth, and you're getting all of this nutrition. And especially when people have gut issues, they might have difficulty even breaking down food. So this is a great way to get some easy nutrition. It's really simple to just heat it up. It tastes delicious. And you can also add it to recipes if you don't like just the plain flavor. But I'm telling you, if you've never tried this brand, the flavors are absolutely delicious. And again, it'll support that gut lining and help you reduce inflammation. Okay, here's my favorite tip. Test, don't guess. It's going to get you the fastest answers. If you're one of those people that have been dealing with issues for 6, 7, 8, 9 years, this is going to be a game changer to help you get answers. So here's the truth. The gut is as unique as your fingerprint, And without the proper testing, we essentially are trying to solve a really complex puzzle. You saw all those pieces, like with one eye closed. That wouldn't be too easy. That's why this testing is important for anyone dealing with persistent problems. There's simply no other way to get this level of detailed personalized information about your gut health. We do offer various tests, and we really tailor our recommendations to your specific situation. So every time we have more details, we are able to give a more direct path. And with these precise insights, we target and treat your issues really accurately. It's like a custom roadmap for your gut health. So if you're serious about resolving your digestive issues once and for all, testing isn't just helpful, it's actually essential. And then I like to show you on the next slide a little sneak peek. Okay, so I don't know if this is overwhelming to you or fun. It's really fun for me to see these, but you can see just from this little bit that you get a ton of unique data. So we do food sensitivity testing, comprehensive stool testing, micronutrient and toxin testing, SIBO breath testing, celiac and gluten sensitivity testing. We also do hormones. We look at blood sugars with CGMs and so much more. So I know I talked about a lot today, so I'm just going to go back and recap here. So first of all, you got to cover those basics, those foundational things. Choose one area you might be lacking a little bit and take some steps to make that foundation stronger. It will help you move forward faster. Support digestion through that migrating motor complex, through the vagus nerve, and chew more. Eat some more gut healing foods like the high quality bone broth, and test, don't guess.
Awesome. Thanks so much, Erica. I love those tips, and they are just so impactful, you guys. I can't emphasize enough how much success you can get just by doing the really simple things that Erica's mentioned tonight. Also, just a reminder, if you have questions, to pop them in the chat box, and we're going to be going over all the questions at the end. So this is a really cool opportunity to get some of your digestive health questions answered. And I am going to go over a really interesting case that I worked on with a client. She's really the sweetest lady, and she was super determined to get the answers that she needed in order to feel better. So this is an email she sent me in April of 2023 saying that I had worked with her daughter. She got really good results when she follows her diet. And this particular patient had been having chronic diarrhea since a very specific date, which she remembered because it was so bad. She ended up getting a colonoscopy, and the results of the biopsy that they took during that showed collagenous colitis, which is inflammation in the colon that is associated with NSAIDs, as well as antacids and antidepressants. So the treatment for it was a steroid, and she was on the steroid, and it made a difference, but she suspected, the client did, that she had food sensitivities, and she wanted to schedule an appointment. So a couple more things that you're not going to get from this email is that this woman was 77 years old, and she wasn't willing to settle for not feeling well. She wasn't opposed to working with us despite the fact that we don't take insurance, and she was on a fixed income because she wanted answers, and she knew going through the insurance model or conventional care wasn't being helpful. And she was really tired of being told that she needed to be on medication. So she found it really worth it to invest not only in her health, but also in herself. And she knew that working with us would take time and dedication because she knew what the process was like from her daughter working with us. But she was really ready and willing to do just testing and supplements if needed. And she was also intuitive. I mean, at the end, it says, I think I probably have food sensitivities or allergies. And what we found out, and this is kind of where we start with the basics, but She was on a medication with a known side effect of diarrhea, and I happened to know her physician really well, so I just got in touch with the doctor and asked her to adjust the medication so we could make sure that we weren't going to go down a rabbit hole of testing and diet restrictions when the diarrhea could have been caused by your medication. So anyone on medications right now with digestive issues, take a look at the side effects and just make sure that you're covering the basics too. And this client was having diarrhea up to 8 times a day, twice at night. So she wasn't sleeping, and it's really hard to leave the house when you're having diarrhea all the time. She went on a yoga retreat in Greece with a friend and couldn't leave her hotel room. So that's super debilitating, poor quality of life. And in the middle of us coordinating her care plan, she had to pause things because she got COVID, which caused her to fall and hit her head. And then she needed back surgery. And then she had another flare of diarrhea, which led to also another round of steroids. So she was really determined, and she went through a lot during this process, but she was still able to get really great results. So what we did was a customized plan for her. She needed food sensitivity testing. We ran a stool test. We did a micronutrient test. And in the meantime, while we were waiting on all these results, I gave her a meal plan with some really easy to digest gut healing foods. And in October, once things kind of settled down and she was on the meal plan, she got some awesome results. She says the trots stopped, no night trips to the bathroom last night. Previously, the trots had been 4 to 5 times a day. At this point, 2 of them at night. What a diet. Something tells me the diarrhea might be food related. She loved an oatmeal recipe that I had sent her, and she was just really grateful that she was feeling better. Um, and we also realized with the food sensitivity testing, she was reacting to honeydew melon and caffeine, both of which she was having every morning. So it's like literally, you guys, as soon as she cut those 2 things out, the diarrhea stopped. She also had a lot of itching that began to resolve with diet. She did have some overgrowth on her stool testing that needed supplementation and very specific strains of probiotics. And she did, on the micronutrient test, need a lot of antioxidant support, and her magnesium was low. So we created a customized plan to support all of the things that she needed. And again, she was very dedicated to the process and wasn't going to let anything get in her way. And I mean, no one wants to live with chronic diarrhea. That's a terrible quality of life. So that's also, a motivating factor in her case, is that her symptoms were pretty severe. So just a super interesting case. We have had a lot of success with several different situations of digestive issues. So who here, you can show us in the chat, has found the content tonight to be really valuable? And one of these things, I see lots of questions going, so we're going to definitely be going through these later. I'm excited to help you guys through some of your questions here. Yeah, so we have a special opportunity for you guys tonight also that I want to talk about for just a minute. We can't give you everything that you need, obviously, to solve digestive problems in an hour, but what we do have is a very special session that we've designed that is just for the people attending this evening. So this is a really cool opportunity to get in and work with us. We're offering something called a gut healing strategy session. This is an opportunity to meet one-on-one with one of our registered dietitians and start working out a customized solution to your digestive problems. And this is a session to get personalized support that will help you uncover what's holding you back from transforming your gut health. So it's really an opportunity to start solving your own puzzle with our guidance, which is really cool. These sessions are really eye-opening, and a lot of times we have lots of aha moments as we're working through intake forms with clients. And it's a chance to put your own puzzle pieces together so you can finally understand why you're not feeling well. And we'll give you a customized solution to solving your digestive problems based on your intake form. And then the goal of the session is for you to stop suffering from digestive problems as soon as possible. And sometimes, like with the case I just went over, we see that happen really quickly. It can just be a couple things that you need to change and you'll get really big results. So what we're including with this session is a complete functional nutrition assessment where you'll get a better understanding of why you have digestive problems. We'll show you clear and actionable steps for solving your digestive problems and also come up with customized meal and recipe ideas. And we're going to give you lab and supplement recommendations if we think those would be appropriate as well. And then we're going to, of course, give you support and encouragement along the way to make healthy changes a part of your lifestyle. And this is really cool, you guys. It's a chance to be able to live a life without the uncertainty and the stress that comes with having digestive problems. And it's a chance to have someone that really knows what they're doing, put eyes on your case, and give you suggestions and support to help make these changes that can be so impactful a part of your lifestyle. So normally these sessions are $299. Tonight we're doing it just for attendees for $97. So that's a huge savings. And then we have some really cool bonuses too for attending. We're giving away a 3-month meal planning membership, as well as a previous testing analysis during your session. So if you've had testing done by another provider, be it conventional or functional, we'll look at that testing and see if we can help use it to solve your case. And we're also doing 10%, up to 10% off of our signature program, which is up to $950 in savings. Should you decide to move forward with one of our programs. So this is a really good chance just to get a plan in place and an opportunity to save some money as well. There's a QR code you can scan to book the appointment. And Jordan, can you also put the link to book in the chat for us tonight so that people can click there as well? Yeah, so it's a really great savings, over a $1,900 worth of savings tonight just for booking a $97 gut healing strategy session.
All right, I have one more patient to talk about today. He actually saw both Rachel and I through the course of his work with us. He had been struggling with IBS for 20 years. And of course, he came to us skeptical, but unwilling to stop trying to find answers. He had tried numerous things before, but it only addressed his symptoms. Yet, like all of our other patients, as you've kind of seen, they're not willing to give up and know that there's something more that can be done. So our approach with him was identifying those root causes to his issues. So the specialty testing. We did not want to just mask his symptoms more or guess. So in our Restore Gut Health program, we crafted a personalized plan and easy to implement solutions. We found he had food sensitivities, leaky gut. He had really increased frequency of need of going to the bathroom every single day. What we provided, there were no fads or extreme changes, and what, in his words too, just reasonable long-term strategies. He was really amazed, even after 2 weeks, that when we have that second session, how quickly he saw results. We do all virtual sessions. He travels for work, so he often took his appointments in the car. So we try to make it really convenient for you as well. And after each virtual session, he would make those couple changes we talked about, the next step, and really made progress all the way through. And not only did his IBS symptoms improve, but he was dealing with, high cholesterol issues, blood sugar issues, and all of those changed very significantly back to the normal range. So he still maintains what we have done, what we worked on together, and very happy with the program.
Yeah, such a cool case. And I love that you guys both were able to work with him on that. Really awesome situation, awesome guy. So another thing, you guys, too, back to the gut healing strategy session, is that it comes with a money back guarantee. So if you book a session for $97 and you walk away and feel like you got absolutely nothing out of it, we will give you your money back on the session. So you have nothing to lose by signing up for a session. And I just love this image as kind of the concept that we're going for here. It's just an opportunity by booking a gut healing strategy session to take a step towards transformational change. So I really want tonight to be the turning point or the next step forward on your healing journey. And it's just a really powerful move. Just signing up for the session that's just $97 is a really powerful move in the direction of change. And it's about, I love this concept too, it's about breaking out of old habits and developing new ones. So not being afraid to take a step forward when it comes to improving your health. And I think this is really interesting. So about 15% of people are affected by IBS, and this is probably low because a lot of people with digestive health issues are not going to the doctor because they're embarrassed. So the number is probably much higher. And 25 to 35% of people that suffer with IBS also suffer from depression and anxiety. So digestive issues really hurt your quality of life. There's a decreased productivity of about 8 days per month and 1.5 missed days a month on average from work or school. And then the out-of-pocket spend, this blows my mind, is $1,000, over $1,000 a year. And that's just managing symptoms. That's not solving the problem, right? That's just managing the symptoms because you have a problem. And then it takes 4 years on average to get diagnosed with IBS. And when I think about this, it's just really frustrating because I think about what I went through with my husband, but I mean, it's literally years of doctor's appointments. It's time away from work and family, arranging childcare if you have kids, which comes with a cost. There's stress awaiting test results, procedures, and medications that also cost money. So it's a lot of time and frustration and stress just trying to get diagnosed.
All right, I'm going to jump in and talk about one last client that is very special. Her name is Christy. She worked with me a couple years back. Specifically, she was a SIBO case. And one of the things that really stands out about her case to me is like all the things that you think should go a certain way ended up not, which is just like a great lesson in life to be able to kind of like go with the flow and also learn along the way how to bounce back. By the time she had come to me, she had already been to a couple different providers. No one really could get her answers. She had been through something really, really stressful, family event. She's a caregiver for a family member that had a pretty scary cancer diagnosis that thankfully then that family member ended up healing and feeling better, but she was just absolutely depleted and stressed out. We did some testing with her. We figured out that she had SIBO, and then she chose to do a certain antibiotic treatment for her case, which required us to work really closely with her doctor and not spend we started hitting bumps along the way. One doctor wasn't going to order the medication. So one of the things that I really did for her is I told her I would do this, and I did, which is I would go to the end of the earth to, one, get her answers, but get her the help that she needed. So we were constantly faxing, phone calls, you name it, with her healthcare team to get her what she needed, but we got it in the end. She's feeling so much better. And I feel like she overall left our practice feeling very heard and taken care of, and that she had someone on her side, which is what we want you guys to feel as you're diving into this journey with us.
Awesome. Thanks, Rachel. Yeah, so the next steps tonight would be to book your appointment. We have a QR code, and there's also a URL that you can click on in the chat tonight. I'm going to show you guys how to do this in a minute, but here's what to expect. You can select who to work with based on availability, and you're going to, I know Erica has the most availability right now. I have openings starting in November, and Rachel is switching to more of a behind the scenes role. So you'll be supported by either myself or Erica with this. And so I would choose either of us to book with, and then you'll see our availability on the next screen. If you don't see any availability under a certain month, just bump forward to the next month and look for a green bubble that's highlighted. I know we've already had some people booking, and we do have limited spots for this. There's going to be a spot to put in your name and your contact information. And then when you move forward, you'll enter payment information to secure your spot. And then once it's scheduled, you're going to go to a page that lets you know that the request was sent, and then we'll approve the request this evening and you'll get a confirmation confirming the date and time of your appointment. You'll want to make sure to add the appointment to your calendar and then be on the lookout for a final email from us entitled New Forms to Complete. And you want to make sure to fill out your forms at least 24 hours before meeting with us. This is going to be where we're getting your information to help start putting your puzzle pieces together. So make sure that you do have time set aside, maybe at least 30 minutes to fill out the form so that we can, make the most out of our time together. So this is a really impactful thing to think about too tonight in terms of your next steps. You can keep doing what you're doing, whether that's looking around for the right provider, trying to solve digestive problems using providers that take insurance, or trying, another probiotic, another supplement, another squatty potty, or continuing to live with your symptoms. Or you can book your strategy session and start moving the needle forward on transformational change. And I promise you guys, these strategy sessions are so impactful. You just get so much out of meeting with us and getting a plan together and getting a good set of eyes on your case. And if you don't take action 5 to 10 years down the road, you might be exactly where you are right now. One of my favorite quotes is "The body whispers before it screams." And the inflammation that underlies GI issues is also the underlies other things that we really don't want, right? Like I said before, cancer, diabetes, heart disease. So we really want to make sure that we're on top of our health and listening to our bodies. And I just think about this too, like we have so many clients that have missed vacations or missed, time with family and friends or dinner parties or, you name it. But like, we don't want that to keep happening and we don't want it to happen to you. So, the better you feel, the more that you can do and the more that you can really live the life that you were meant to live and that, you can imagine, achieving all of your dreams and feeling really good all the time. So, I think if you're here, we can agree that you're experiencing digestive problems. You want answers so that you can solve them. And ultimately, what you want, and I think what a lot of people want, is freedom to just be able to live life the way that you want to on your own terms and enjoy really good health. So at the Gut Healing Strategy session, you've got a chance to meet with someone who listens and cares and wants to help you feel your best. And you're also going to get really clear and actionable steps to start solving your digestive issues. And it's really hard to do this on your own, and it can really take years and years of trial and error. So having someone guide you through this process can be really impactful. And again, you have a money back guarantee on it. So if you meet with one of our dietitians and walk away feeling like you didn't get anything out of your session and totally wasted your time and money, we will give you your money back. And then the first 10 people tonight to schedule their appointment get an extra 5 to 10% off of our signature programs. This is our fast action bonus. That's up to $1,000 in savings. So if you put all that together, just for the $97 Gut Healing Strategy session, you're also getting the 3-month meal planning membership for free. We're going to look at previous testing that's been done with no charge. You get up to 10% off of our signature program. And then the first 10 people that book get up to an extra 10% off for a potential 20% off total of our signature program. So that's almost $3,000 in savings just for the $97 Gut Healing Strategy session. So at this time, we're going to go through any questions that you guys might have, and I'm going to check the chat. If anyone's having issues scheduling, it looks like we're having people get appointments booked pretty easily. I will go through that process and demo it for you guys. Cool. I'm going to jump in and just demo this real quick. Okay, so if you guys are trying to book a strategy session and you're stuck, I think first of all, this works best from a computer. But what you would do is select one of us. I would pick Erica because I know she has more availability right now. The book now button, and then you're going to find a date that's highlighted in green. So her next opportunity is on the 2nd of October. So you pick that date. And then you'll get a drop down where you can select a time. So she's got one opening that day from 9 to 10. These sessions are 60 minutes. You're going to hit next, and then you're going to put in your information here. And then when you hit next, it will prompt you for payment, and then your appointment will be confirmed after that. So if anyone's having issues with booking, just let us know in the chat and we can support you through that. And we do have a limited number of openings. So I just want to make sure that if you want to get an appointment because you're here tonight, that you definitely are able to take advantage of these sessions. Again, thank you so much for your time tonight, you guys. We really appreciate it. We love getting to talk about this stuff and helping people. So yeah, I hope this was really valuable for you guys. And thanks again for coming out.